Hello and welcome to Nurse's Handbook. Today I will be discussing with you about a very important as well as a common topic, that is types of insulin, a very common medication used in the clinical setting. So before I begin with the types of insulin, let us see a little background of the insulin. Insulin is a medication that helps diabetic individuals manage their blood sugar levels, and it is the only parenteral anti-diabetic drug that can replace low insulin levels exogenously. It was first discovered in 1921 by Banting and Best and was initially extracted from beef and pork's pancreas. In the early 1980s, synthetic production of human insulin began, and nowadays insulin analogs are replacing human insulins. So what is analogs? Analogs means similar to something else. So insulin analogs are analogs that have been designed to mimic the body's natural pattern of insulin release. Now let us see on what parameters is the insulin being categorized. First is onset, that is the time taken by the insulin to reach the bloodstream and start decreasing the blood sugar. The next one is peak, that is the time during which insulin is at maximum strength in terms of lowering the blood sugar. A very important point to remember here is hypoglycemia is most likely to occur when the insulin has the strongest effect, and that is at this peak. Our next parameter is duration, that is how long insulin continues to lower the blood glucose levels. Our fourth parameter is concentration, means the availability of dose, whether it is available as 100 unit per ml or 40 unit per ml. Our last parameter is the route of delivery, that is how the insulin is administered, whether given subcutaneously or intravenously. So depending upon all these parameters, the insulin is being categorized. So now let us see the different types of insulin. Basically, it is divided into four main types. First one is the rapid acting or the fast acting insulin. Then we have short acting insulin. Third one is intermediate acting insulin, and the last one is long acting insulin. Now let us see one by one these types of insulin. Let us see the very first type of insulin, that is rapid or fast acting insulins. They are absorbed quickly from the subcutaneous tissue to the bloodstreams. So it is given right before the meal. It is also used to correct high blood sugar levels, and that is why the rapid acting insulins comes under the category of bolus insulins. Examples are insulin lispro, insulin aspart and insulin glulicin. And the mnemonic to learn it is LAG, L for lispro, A for aspart and G for glulicin. Rapid acting insulin has its onset of action within 5 to 15 minutes, and that is the reason why it is given just before the meals. Its peak effect will be in 1 to 2 hours, and at this time there are chances that patient may go into hypoglycemia if a proper meal has not been taken by the patient. Its action remains for 4 to 6 hours. With all doses, larger or smaller, the onset of action and the time to peak effect will be same, but the duration of action will be affected. That is depending upon the dose given to the patient. Important thing to note that this rapid acting or fast acting insulins can be mixed with intermediate acting insulins. Now let us see the second type of insulin, that is short acting insulin, and the example is human regular insulin. It also comes under the category of bolus insulins, as it can be administered subcutaneously and intravenously to reduce the high blood sugar levels. It is also given before meals. Its action begins within 30 minutes to 1 hour, so it is not compulsory to give right before the meal, but it should be administered half an hour before. Its peak effect is in 2 to 4 hours and duration of action remains 6 to 8 hours. point to remember is in the usage of insulin regular, larger the dose, onset of action will be faster, but peak effect and duration of action will be longer. One more important point to remember is that the short-acting insulins can be mixed with intermediate-acting insulins for use. Stay tuned with Nurse's Handbook as the types of insulin will be continued in the next video.